today. This is Miss Mary. Isn't she lovely? We're going to be doing some filler on her today, okay? So one thing we're going to really work on is trying to elevate and lift her cheeks because she's got a thin face, so she's lost some volume through the cheekbone area. She also has some little imperfections in her skin that I'm going to fill with a product called Bellafill. And what that is it's a permanent filler. And we love it for acne scars. We love it for any kind of scarring process, anything that's just a little depression or not smooth in the face, we can use it for. And it'll be permanent for that. We're also going to put a little bit of filler, just a little, give her a little volume in her lips. She has beautiful shape to her lips, but she's just lost a little bit of kind of the fullness. So we're going to do just a little bit of filler in there. And that's really mostly it. She just needs a little bit of lift. So we're going to start with that.
From your mouth to God's ears.
Oh, we're also going to do some Botox for this baby. So smile at me. So she's got a little bit, when she smiles, she's got a little bit of the crow's feet in the crow's feet area. Frown at me. Yeah, and that little muscle right there, a combination of muscles causes those little 11s is what we call those. So we're going to relax those muscles so that softens that area. That'll also keep her eyebrows lifted nice and beautifully. So let's start with a little Botox. Oh, thank you.
Can I have my eyebrows tattooed?
Anytime.
Oh.
Yeah, you're good to do that anytime. So feel free to ask questions if you guys have any questions as we're going, okay? Alright, so I start with a little bit of ice because we don't want this to be uncomfortable. She has had some numbing cream on as well. Little brain freeze. You doing okay, sweetheart? Mm-hmm. Okay, good.
Brain freeze without the ice cream.
You're right. Now, without the joy of the ice cream. You're exactly right. Beautiful. So we just go right into those little muscles, and it looks like it should hurt, but it's really not too bad, is it, dear? Not bad.
I don't feel it.
All right, now we're going to do a little bit around the eyes here for you. Will you hand me my vein finder over there, Erin? Mm-hmm. So this is a device that I like to use when I'm going around the eyes because there are lots of little blood vessels around the eye, and this little device can show me where they are. And so I like to use this to kind of locate them because then I can kind of get away from them. She doesn't have any really big ones there. There's one right down there that I'm going to stay away from. All right, dear. And smile for me. Perfect. Little pinch. Beautiful. Go to the other side here. Oh, there's a deeper one right there. Mm-hmm. Okay. Let's avoid that little fella. I'm going to turn you this way. Smile again. Now relax. Perfect. So that little vein was right there, so we're going to go away from it a little bit. And right there. Beautiful. All finished with that. Okay, let's go ahead and do some Bellafill. Let's get a few of these little spots. That one for sure, that one for sure.
Oh, you did this one already.
Yeah, I'm going to still put some there, though. I think that one needs a little bit still. Thank you. All right. I'm just going to make them perfect as we can. We like perfect. Pinchy, pinchy, baby. So this is the Bellafill. So this is the more permanent filler that we're putting in right now. And we just put it right under the skin just to pop those little spots right out. That looks good. A little bit of a depression right there. We're going to get that little guy.
Are you using Bellafill for all filler?
No, I'm just using Bellafill just for any little scars or imperfections in the skin. So like acne scars, chickenpox scars, surgical scars, anything that we want a permanent fill. I don't love a permanent filler in a lot of areas of the face because our face changes over years. And you don't want a permanent filler that's going to fall with your face, right? You want a filler that we can then use to kind of maneuver the skin.
Okay, so it's one kind of superficially then.
So we're going right into that little tissue, right, to pop those little lines out. And it does. We do use it in some cases in deeper lines that we can't get completely filled with the deeper fillers because I can go really superficial with this. Like that little guy, I just put just a little bit in there. Erin, I'm going to have you hold a little pressure right here. She's trying to get a little bit of bleeding on that one spot. I'm going to turn you this way because I need the light. Normally I have everybody under a big surgical light so I can see exactly what I'm doing, but we've got good daylight here, so that helps. How you doing, baby girl?
All right.
She's tough. Tough little cookie. Good.
Can you do that scar on my nose?
Not with this.
Okay.
Actually, maybe I could. Let me see. This little guy right here. Is that what you're talking about? The nose is special. It hurts a little bit, but she's tough. She's not even flinching at me. So let's try to get a couple of those little guys. So you just literally go into any little spot you want to pop up, and it's super easy. It just goes right in and just completely eliminates those little fellas. Just massage it in a little bit. It's looking good up there. Good. Good, good, good. Everybody doing okay? Nobody passing out on me out there? All right, let's see. Any other spots?
The corner of the eyes.
Right in there.
In the corners there where there are little scars.
Yep, let's try to pop those out a little bit. Okay, here, over here too. How many places can
I'm
we hold,
springing
right?
a leak.
You're springing a leak. So as I go into these little scars, I actually kind of go back and forth with the needle, which sounds creepy, but it actually breaks up the scar tissue underneath the skin and it stimulates the body to heal that tissue as well. So in addition to healing, we're kind of smoothing that area out too. How you doing, baby?
Good.
Numbing cream is also good. We like numbing cream. What about forehead? Any others on the forehead you
I'm
see?
sorry, but what are you using now?
This is still Bellafill. I'm just going around trying to be a Nazi and making it perfect. I have some OCD issues.
You and me.
Right? I have a list of people who would not mind being a demo. Yes.
She said right in here.
I don't know if you see it or if it's just me.
It's filling in pretty good.
Really?
Let's do there. Do just a bit there though and smooth it in for you. So Bellafill is, it's one of the newer products on the market. They don't do a lot of advertising because it's kind of a niche product. They say that you can use it for filling everything. I don't love to use it for filling everything because, like I said, your face changes over time. So you don't really want a filler that doesn't change, right? You actually want to be able to, as you age, to kind of put filler where you need it. And when you have something permanent, if your face falls, it falls with it. And there's not a thing you can do about it. So for that purpose, I don't love it. But I do love it for little spots where we're just trying to smooth the surface of the skin.
So I guess my girls are out, huh?
The girls are, well, you know, theoretically. It's going to, you know, theoretically. But they're going to sag too, so we don't want to put them in there and put it in there either. I wish the girls wouldn't sag. That'd be so nice if they just would stay perky up there. Oh, and that just popped that last off, so that's the end of that. All right, so no more Bellafill. Let's do a little bit of Juvederm. Oh, let's do Voluma.
I think they're over there. Yep.
All right, you've hip cleansed her?
I have not had a fire. I don't know what Teresa did. Good.
Isn't she pretty?
She is gorgeous.
That's you know,
But so
that's
are
part
you.
of the beauty of Erin is that she's so pretty. People can stare at her while I
Or
inject
I
her.
can stare at you.
All right, let's lift these cheeks up, shall we?
Which one? Which ones?
Well, these to
These?
start.
Oh.
Maybe those later. You're so funny. Okay, so for this, you can see when she smiles, you can actually see the lines coming through here. That's not just because of muscle contraction. We're going to smooth that out with Botox. But because she's lost some volume in this lateral cheekbone, her cheek is kind of falling down and forward a little bit, and these lines show up more, okay? So what we're going to do is go down and really just resuspend her cheek. Just kind of support it back up there, okay? So this is going to be a little stick. You ready, baby? Try to shake as we go. Always pull back to make sure I'm not in a blood vessel. And then you just inject really slowly to kind of lift. And that just kind of pulls her cheekbone back up. Smile at me again. So you can see those lines are already lessened just by that one little injection, okay? And then I also like to go just a little bit more at an angle and still really deep. And just smooth that in. And you think, oh, you're going deep, it's got to hurt more. Actually, the more superficial you are in the skin, the more it hurts. So the deeper injections usually aren't as bad. Of course, she's going to look like a pincushion today because I've gotten her so good here. Just lift that cheek right up. You can actually see the lines kind of going away as I inject. Can you appreciate that on the video there? Okay, nice. And then we blend this cheekbone in. I'm going underneath just a little bit more. Because what we don't want is that super weird, unnatural ball of the cheek, okay? We want it to be cheekbone high and then blend into the cheek. You don't want it to just be kind of this big ball. And that's what we see, I feel like, with a lot of fillers these days. A lot of people are putting too much filler in the cheek and they're making people look a little bit unnatural. Like when they smile, you almost can't even see their lower eye if you have too much filler there. So that looks pretty. Smile at me, baby. Beautiful. All right, I'm going to do a little bit in the middle of the cheek, though. Hand me that thing finder one more time. So there's a little vascular bundle right here on the mid part of the cheek. Little nerves and blood vessels that run right there. And so I'm going to stay away from those little buggers. And so I'm putting my finger on them. And then I'm going right over here away from them. So I know my anatomy, but everybody has a little bit of a different variation in their anatomy. So this little tool is really, really nice because I can really avoid those danger zones that way. Beautiful. Okay, let's hold a little pressure over here. All right, switch with me, Erin.
Erin,
Yes, ma'am.
Teresa said she was going to do something for the darkness of the guys. Oh, okay.
Yeah, so
Am I springing leaks?
you're fine. You're good.
Oh.
So she was actually asking me about the darkness under her eyes. So we're gonna lift up the cheeks first, and if we still see that little darkening, then I can actually put filler right into that little hollow, and that'll just pop that skin back up so you don't see the darkness of the blood vessels underneath. All right, vein finder me, where'd he go? We need about 10 hands, don't we? Okay, so can you guys see that little blood vessel right there? We're staying away from that bugger. It's right there, so I'm going right here, and I'm going under it. Always pull back, make sure I'm not close to it. Beautiful. That just gets that cheek lifted. Let's turn you this way a little bit. Smile at me again. Yeah, so this cheek doesn't need quite as much volume, but it does need some. One more volumen. And always mold it and make sure it feels nice and smooth and even. Hi, Joyce and Kim. Hi. Two of my besties snuck right in on me. So yeah, watch those little lines just kind of go away. Very pretty. All right, sweet girl. Almost finished with cheeks. You're doing great. All right, now let's see a little bit for the tear trough. All right. You do the vein finder for me and hold it for me, will you? Okay, so Miss Mary, what I'm gonna have you do is look up at the sky for me, baby.
I just push this.
Yep. Because that way I can see all of those. And we're gonna go right there. Now you can move it for a second. So this is the tear trough. So I'm going right on the bone. So this sounds creepy. Can you hear it? A little bit? Not really? Too loud out here. So I just go right on the bone here, and that's gonna pop out that little tear trough. Hit me again. Put it right on her eye, right there, underneath, and right there. Good, now let go. And again. And we're gonna go right there. Perfect. So that's just going to blend that cheekbone and that fat pocket underneath the eye so that you don't see any real difference. It just makes it nice and smooth and even of a transition there. All right, let's do the other side. Oh yeah, okay. Got one more. Oh, that's going to be pretty. You don't have a hollow over there anymore. It looks good. So now we're going to try to go for this little hollow on this side, because you can see she's got the dark circle here, but not here anymore. I mean, it just immediately pops that right out. Of course, you're like a pincushion, because I've poked you to death, but... Okay, vein finder me. Okay, so move it for a second. Need to go there, go again. Okay, so we're going to go under that, right there. Okay? Okay, and I want to go here, so go again, Erin. And I would have gotten her. Okay, now go away. And no more circle. Hallelujah. That's going to be gorgeous. All right, now let's do a little bit in her lippy lips. Ultra will be beautiful. So we were just talking about how her lips are beautiful shape, right? She doesn't need any redefinition of her lips. She doesn't have any lines around her lips at all. But she doesn't have the fullness anymore because her lips look almost wrinkled, okay? So what we're going to do is just put a little bit of volume back into the normal fat pads of the lip, and it's just going to make her lips look a little bit more full and a little more natural. That's ice, baby. Okay, we're going to start with your lower lip, Mary. Your nails are pretty.
I have to go get them done.
They actually look good. Isn't she out of this world? Check out her pants.
I am out of this.
She's out of this world, this one. Okay, now, mimosa. Okay, open slightly. Okay, so there's a little pocket here normally in the lip, and we just go into that little pinch. And we just do a little bit of filling there. And you can see it start to just smooth out the lip there. Put 0.2 in that side. We're going to come around and do the other side.
I heard you say Xanax. Doesn't
The
even
numbing
hurt.
cream really helps, especially on the lips. I would not do lips without numbing cream.
I know.
Too sensitive.
And then do you, for people that get,
For fever blisters, yes, we treat everybody with fever blisters with Valtrex because any trauma around the lip can make those little fever blisters pop out. All right, Mama, open one more time. Beautiful. And then I want a little pouty pout, so we're going right in the middle. You ready? And then, open for me, and massage. Just to make sure it feels smooth. Nobody wants lumpy lips. Not what we're going for. Okay, pretty. So can you see her lip is already a little bit smoother? The beautiful thing about this product as well is that it pulls a little water to itself, so she'll get even a little bit more fullness as the product is kind of in there. All right, let's switch again since I massaged.
No pain.
Yeah, we'll stay with the Judy because I'm going to do her upper lip. And then we're going to be good. Does she need it there?
No
Yes,
pain.
she does. Good. Yeah, we'll do a little bit of that too. All right, now open again for me. Same thing for the upper lip. Good. And then we're going to go right in the middle, this little tiny one, pinchy pinch. Beautiful. And then on this other side, one more pinch. And Erin always gives everybody a little love. She gives the moral support over there. Perfect. One more massage. A little sensitive. The lips are a little more sensitive.
But the needles don't hurt.
It's just you feel that fullness kind of going in. It's weird, isn't it? Beautiful. So that's just going to be really pretty and just give her a little fullness of the lip, but still very, very, very subtle. Now the last thing we're going to do is fill these little areas right here at the corner of the mouth so she doesn't look frowny. We don't want any frowny. goodness, baby. Little cutie pie. Okay, no smiling.
No, you can't.
You can't help it but smile at that cutie, can you, baby? Okay, so we're gonna do right here in this corner. We're just gonna lift up the corner here a little bit. I kind of do it in a little V shape there just to give it a little substance. Pretty. And then I'm gonna fill this little hollow just a little bit too. Good, because see, we just want it to be smooth. We don't want there to be any deep depressions anywhere. So that's going to even that out beautifully. Okay, got one more? And one more time over here, baby. I heard someone say it's subtle. That's the point, okay? I don't want anybody to leave here and somebody go, whoa, you've had a lot done. I want people to go, wow, you look great. Are you sleeping better? Have you lost weight? What is it? Yeah, if you can tell that I've done a whole lot, then you really probably, it's probably not the right deal. So this is just basically just enhancing, just lifting, filling the skin. So these are different types of filler products that I'm using. You itchy?
No, it's just
It's
one
numb.
scar.
Oh yeah, I got him.
Oh, good.
I got that with Bellafill earlier.
Good.
So basically, there's about, gosh, 7 or 8 different products. Okay, so it's kind of tricky if you don't know all of the different properties of the different products, what to use where. So that's why it's really important. If you're going to have things like this, you really want to go somewhere where people actually know what the heck they're doing. Because otherwise, you can put the wrong product in the wrong place and it can be a real problem.
Well, on your, the purchasing, there were a lot of films, and I didn't know where to put the money.
So here's the thing. The vast majority of these filler products are about $600 a vial, okay, or syringe. Most of the time, if I'm doing cheeks, I need 2 syringes, 1 for each cheek. If I'm doing this area, I need 1 for each side. If we're doing lips, depends on what you want. If you want Kim Kardashian lips, which I don't recommend, then you need 2. If you want normal lips, then you need 1. So you can just kind of pick and just put money on there, and we'll pick the right product for you. Okay? So it's not like if you came in and said, I bought 5 Voluma, I'll go, okay, well, you don't need 5 Voluma. We're going to do this, 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 and this, and if we have money left, then you go get a hydrofacial. So, I mean, it's not like you're going to be out. So I would just estimate based on what you're trying to do and go with 2 or 3 of those. Okay. All right, gorgeous. You did it. So I want to see you in 2 weeks and make sure we're perfect. Okay? So when I do filler, usually within 2 to 3 weeks, we can see that the collagen is starting to build in and around. Any swelling from the procedure is going to be down. So we're going to be able to see exactly what we have. And if there's anything that needs to be tweaked or corrected at all, we can definitely do that. You did awesome. So ice, baby. Okay? Try not to sleep on your face if you can keep from it. Do you ever get fever blisters? I don't remember. Never. Okay.